He has received numerous professional awards and recognitions, including a former 2015 national finalist for the White House Fellowship, the 2017 Carolina Center for Medical Excellence South Carolina Physician of the Year Award, and the 2019 USC School of Medicine Dean's Award for Excellence in Community Service. He has published in peer-reviewed journals and has presented at numerous national and international society meetings. He currently serves on the World Stroke Organization, World Health Organization, WHO, Global Guidelines and Policy Board, the AHA National Advocacy and Policy Board, and the South Carolina Department of Health and Environmental Control, DHEC, Stroke Advisory Council. His primary research interests include improvements in stroke systems of care and health disparities in stroke outcomes and care, especially in South Carolina. He is the founder of Holy Strokes, an African-American faith-based initiative to provide free stroke education and cardiovascular screening. So please join me in welcoming Dr. Yallapragada with us today. Thank you so much for being here. We're definitely honored to have you and appreciate your time today. Absolutely. And so today what we know is that we do have churches that are joining us, people from the community. And as you are aware, a couple of weeks ago in the month of May, the governor of the state of South Carolina began allowing entities to start opening slowly. And now among those entities are churches, faith-based places of worship, synagogues, all of those. And so we just want to take some time today to ask some questions that have been sent in and receive some guidance on opening churches, or what you would do, what you wouldn't do, looking at safety precautions in lieu of the pandemic of COVID-19. So we will jump right in and begin to go ahead and ask those questions. Among one of the first questions that we wanted to ask, before even proceeding with opening a church, if the rate of infection in your city or town is increasing, is it even feasible to consider in-person service at this time? Or should we assume that a certain amount of risk in church attendance is now expected?
Knowing how it's going to behave and how it's to Florida, South. All over the Southeast, and each of them have different dynamics, different sizes of churches, different impacts that COVID will be having. So what we need to do to be safe is to work in concert with the local public health departments, HHS, DX, and gain an assessment as to what is actually happening with this COVID infection. Is it decreasing? Is the reporting going down? What is actually happening with the severity of the illness? Because, just because someone says, okay, now it's safe to open churches, does not mean that it's safe to open churches everywhere. It's going to vary depending on the location and also the circumstance of the type of community that may be served by that church as well. So I would say that if you're seeing that there's a surge in COVID, either the diagnosis, which may be because of increased testing, but the prevalence is increasing or the incidence is increasing, we're seeing more deaths, then I would be a little bit more cautious and a little bit more stringent on how we open these churches if we do decide to open those churches to begin with. Many churches are traditionally right now doing virtual services, which is working very well. This is reported all across from Louisiana and Alabama, Texas, and a lot of churches are going to continue to do that. for the near future. So we shouldn't feel rushed. Safety first, by all means.
Right, so it sounds like churches really need to kind of pay attention to the numbers in their specific areas and make those decisions based upon that in their local guidelines.
Absolutely, scientific and calculated, educated decision making here for best safety.
Okay. Our next question says, as churches consider returning back to general worship with larger groups gathering, is there guidance on who is best not to participate in corporate worship at this time and why? For example, that could be older adults, children, people with compromised immune systems or whatever. So who might not be best and why?
Great question. This is a major concern as to how we open, and it's almost going to be like we're phasing the operation of church access. Unfortunately, not everyone will be able to attend in the beginning, whether the church opens or not. It's going to be a very sticky situation. What we've seen with COVID-19 is that elderly individuals, especially with chronic illnesses, are highly susceptible to severe illnesses. And so we recommend our elderly population above the age of 65 and the pastors also to maybe consider limiting their exposure by allowing for maybe special viewing through social media or web access or Zoom, or maybe having a special separate service for those individuals. But like you said, also a lot of individuals who may have immunocompromised conditions, chronic kidney disease on end-stage dialysis or severe renal impairment, people with uncontrolled diabetes, BMIs greater than 40, which is severe obesity, individuals with cancer on chemotherapy, certain medications that suppress the immune system, like corticosteroids or other medications. One of the things that I've realized over the past 4 years, going into different churches throughout South Carolina, especially in our Midlands, through our Holy Strokes program, we assessed risk factors in the African American population, and there's such a profound prevalence of diabetes, of heart disease, of even cancers or hypertension, and especially obesity in the female population, that we have to be especially careful in African American churches when we're going with the COVID-19 crisis. Sadly, all churches, all humans are created equal, but all churches are not created equal. We have different disparities and different health situations, and we need to be cautious with populations that may have a higher degree of comorbid conditions that could be really hit with COVID. So I would suggest individuals who have a lot of these comorbid conditions that aren't controlled, be very careful to show up in a setting like a church where they can easily contract COVID. These individuals may benefit from just kind of viewing virtually while we get this under control, that being the pandemic. And then also for them to also get their health under control and use this time to get their house in order and those type of things.
Okay. What would be some of the best practices for returning to corporate worship while the coronavirus pandemic continues, if churches decide to do so?
This kind of ties into the last question, and I'll add on a couple more things that you can also apply to the last one. One point that I want to make is that if somebody is having symptoms, such as fever, new symptoms, fever, cough, loss of taste or smell, new onset like diarrhea or GI upset, new onset headaches or muscle aches, almost like flu-like symptoms, then they shouldn't come to the church, and the church should be screening them because if they do have COVID, they could be infecting others. Or if somebody has had recent exposure to someone who's had COVID or is waiting for a test result to come back, they should also be cautious in coming back to church. And the third population I would be cautious with as well are people who may be healthy, but they're taking care of an elderly mother or father, or they're a caregiver to someone who's sick at home. We don't want them to come into a situation where they may get infected and still be asymptomatic, but go home and pass that on to their family member or their loved one. And so some of the best, I think you asked about best practices. Some of the best practices is, it starts number one with communication. Communication is essential for our churches to reach out to the flock and reach out to the congregations, in the sense that we need to be able to communicate to our parishioners of what our expectations are as far as if you have these symptoms, please do not come. We're going to screen you before you come in. And if you don't have, we would rather you not come to church that day because you could put others in harm, but we will have access to virtual seminars and virtual services. The other thing is also some churches, especially I was watching some churches in Alabama, they were having, and it was a Catholic church, but they were having the opportunity to make reservations to attend services. So there may be a need for, if a church traditionally had one service, because of the need for social distancing within the church, in order to accommodate multiple numbers of people, you may have to double or triple the number of services in the day, okay? So that's an important point, but the way you do that is you want to have reservations set up so that people can reserve online for what service is going to come, so they also know that they're, and then by clicking that reservation, they acknowledge that they don't have symptoms, okay, and that they don't have any of those risk factors like, you know, being on chemotherapy or, you know, have uncontrolled HIV or AIDS that may affect them if they get infected or some things like that, or uncontrolled diabetes, but also it allows the church to prepare and accommodate for the number of people. Okay. So the seating could be also feasible. That way people don't get turned away. You probably want to have some kind of a mental or a pre-preparedness, a pre-screening capability that allows you to say, you know what, we're going to be able to fit safely within this church 100 people, whereas normally we would be 300 people. And so that way you can cap off the reservations at 100. The first 100 to reserve can have the seat. Then you, if not, there's service number 2 or service number 3 you can try. So that would be one major best practice. The other best practice is, of course, some churches have developed flow patterns of entering or exiting the church, or as part of any kind of ritual, arrows and in the form of tape on the floor, guiding parishioners as to, so that way you have one-way walk paths. So direction is very important, so people aren't walking into each other and coughing and those type of things, that everyone enters a certain way and exits a certain way, and if they're going to use a restroom, they have to go a certain way, and everything is a flow basis, would be very important. When we're spacing, you know, individuals, we want to keep them about 6 feet apart. That's equal about 2 arm lengths distance with each other in the pews, unless, of course, they're, you know, families that live together or spouses, or they're usually around each other anyways. We don't need to separate those individuals. This will allow for more space within the church. So you're only separating groups from individuals that aren't associated with each other by 6 feet. And then we want to keep every other pew would be optional, is a lot of the best practice that's going on to keep safe distance. As far as materials, a lot of churches, you know, have Bibles behind the pew seats and pens and, you know, papers and stuff like that. And we'd like some of the best practices that we've seen. And of course, a lot of this information I'm getting is from the CDC, but also discussing with other public health experts around the country and reviewing other church practices. But they would remove the Bibles and remove any kind of objects that could transmit through touch any of the virus. So basically, some of the churches that I've seen have started using technology again, in the sense of like sending hyperlinks to the phone to download information, you know, any kind of scripture or anything that they want to pass on would be through the cell phone technology. Or as they're entering, you can hand out papers, would be fine. We want to limit the amount of people and parts of the church which involve people shaking hands or hugging or in close contact. We want to discourage people from touching each other. I know that is a big part of the church experience, is the communal experience of bonding. One of the other things that we've seen is that singing in the choir, a very loud singing especially, and amongst the choir, but also in the congregation, can facilitate in the spread of aerosol viruses. So we want to limit that. Maybe if you're going to play music and inspirational hymns, if you could just display it through the speakers, would be the best thing to bring the sound and the feeling in while we get through this in initial stages. And eventually, as this coronavirus kind of wanes away, we can return with choir being part of the ceremony. we want to recommend people wear masks, okay, unless there's some limitation, especially like in children under the age of 2, or if there's an elderly who's uncomfortable, who is attending. And of course, the pastor or the church leadership needs to make these decisions. These are just recommendations and things that are out there that we're throwing with the best practices. But the mask is helpful in preventing the spread. People can still get infected through the virus entering in through the eye and those type of things if it's spreading, but the spread itself will be limited, and it's been shown that the mask does have some benefit. We would like, ideally, before people enter into the church, a temperature check would be helpful to make sure there's no fever, would be ideal. Something that where you're not touching the person, but you just put it up to their forehead. And a questionnaire that could just be asked simple. Have you had any recent cough, muscle aches, fatigue, loss of taste or smell, or any kind of flu-like symptoms? And obviously, as they've reserved their tickets beforehand, if you've done that process, it's kind of already, but this is like a final double check for just double safety. And then also any recent exposure to anyone who's had COVID would be a good one. So those are some of the best practices that just pop into my head at the moment. If anything else pops in, I'll let you know, but that covers a lot. I think having hand sanitizer is really important, okay, accessible. So as they enter, if you have everyone just kind of gets a little bit of hand sanitizer, sanitizes themselves. And then if anyone's using the restroom, maybe if somebody can help open the door and close the door so only one person is touching the door handle and also the sink handle, that would be, if that's feasible, that'd be great if a volunteer would do that. And then one person in the restroom at a time would be optimal, okay? And then as soon as there's room, if there's any kind of a Lysol spray that can disinfect in the air, that would be fine also. I would say that we want to limit the number of people who are touching the same object. So the microphone, we ideally want to use one microphone per person or limit the number of people. But if you have to hand it off, wipe it down before you hand it off so that the next person doesn't get this infection or potential infection. Trying to think if there's any other best practices. Well, if anything pops in my head, I'll jump in and answer more. But
You covered a lot of them, yeah.
That was a lot of stuff, yeah.
You covered a lot. And I did wanted to just kind of go back. I know there are churches as a practice here. One of our practices here is for people that come in, we have baptism for them. So I do know some churches do baptism. Some of them may do sprinkling. Mm-hmm. Some of them may have the 1-cup communion as a part of their general practice. Any best practices for that at this time?
Yes, I think it's incredibly important to be, we have to be adaptable and practical during these times as we're allowing people to come in to the house of worship. One of those things is, how we baptize. I know some churches may use a pool to baptize using city water, and just and then take the dip and have the baptism, and then the next person comes in and does it, in order to just kind of limit any type of exposure that may happen from mucosa, like conjunctival exposure from one person to the other. Is very, very little chance, but at the same time, to be safe, maybe you just use a practice of pouring water, like you said, using a bucket, or in each individual person gets different water. And the priest can just kind of, or the pastor can just handle one person at a time, rather than everybody sharing the same water. Would be the healthiest during this time.
Okay.
Or sprinkling. Same with oils, just individually done.
Another common practice in churches are funerals. At this time, if churches choose to begin gathering together for worship, what is your recommendation for conducting funerals of parishioners?
Absolutely, I think that's essential. I would use the same exact precautions, just social distancing, directions of how people enter, limiting exposure to items. Just like we discussed before, a lot of the same principles will apply. One of the things I would suggest is that instead of people bringing things to be as like flowers and donations, maybe have it done online through like a charitable organization that you're donating to or something like that, to limit the number of things that are coming into the church and that are being handled between individuals.
One practice also that is common among churches is the giving and taking up of tithing and offering. Some churches use baskets and other means. All churches have not moved to an electronic source to do that. What is a suggestion or recommendation for that practice?
I think this would be a good time to evolve, and we've seen that in our hospital, for example. When we see patients, a lot of times we were not using telemedicine to see consults. A lot of physicians weren't comfortable with that, or having meetings over Zoom or other medium, electronic medium. But this may actually be a good time to evolve to start using electronic donations. But if not, a lot of churches, instead of passing on the collections item, would have it placed at the door. So maybe during a certain time, either everyone rotates through that place safely, or on their way out, they can make a donation if they choose on the way out of the church as well as an option.
Okay. You have answered several of the questions here. I do want to read them. Are there any expectations for the 6 feet social distancing recommendations? And you mentioned earlier that persons from the same household, it is okay for those persons to sit together, but we might want to look at other ways of ensuring that persons stay apart who may not be coming from the same household. You've also talked a little bit about, one of the questions was, what type of arrangements would you suggest for safety? You've talked about tape on the floor to ensure people go the correct direction. You've also mentioned having one way in and one way out so that everyone is clear with that. And I think you also mentioned removing pews, okay? And then another question was, how might we avoid members touching common surfaces? I've heard you say have one person to be responsible for opening bathroom doors, closing them, turning on sinks, one person per microphone, or wiping those down if they are passed. Are there any other suggestions for common surfaces that may be in a church?
Yes, so we have to be very diligent on being sanitary and sanitizing before the service, right after the service, between services. This is something that is highly recommended because people, without even knowing, are touching all kinds of surfaces. And so we recommend sanitizing. And so the CDC with the EPA has put out some guidances on different solutions that can be used. I think one of them was like 1/3 cup of bleach with 1 gallon of water. There's another one that's like 70% alcohol solution that can be used. I would refer back to that, the CDC recommendations. As far as the seating goes as well, one of the benefits of having pre-reservations is that you can reserve the number of people that are sitting next to you if you're in a group. If it's, your spouse and 2 children, you can say, well, I need a space for 4, a reservation for 4. And so then you can almost assign the seating in a way like, pre-assign and organize it in such a way that people can be assigned exactly where they're going to be seating. So then you can plan out the distancing and put X's on the seats, for example, as to where different people will sit. And that would be really helpful as well for you guys to make sure that everything is being adhered to.
Okay. And I do want to go back to one of the questions. Now, I do recognize that we have other persons from other faith-based communities who are watching this broadcast, and we're very appreciative of this because we definitely wanted to share this as community information. Specifically for our church here, our common practice for baptism is immersion by water. And so what might you recommend as far as disinfecting water, keeping water clean, if we're having people who come for baptism, what might be some recommendations for that? And as I said, this would be specific to the Progressive Church.
Yes, ma'am. So I would say that Water has been shown to be a poorly transmissible for this particular virus, okay, to begin with. And the science is still limited as to what is a risk for someone to share in a pool immediately after one person to the next. What's the risk for infection? But I would say that just common sense and best practices would be limit the opportunity for any medium to be between two individuals, whether it's air with 6 feet or with water, which is immediate. And so that's why we were recommending using a bucket or using immersion from a different source than the same source for each individual.
Okay, so maybe 2 different pools may actually work for 2 different people if
Exactly.
you put, gotcha. So
And-
one person here, one person somewhere else.
And if you
Okay.
can anticipate that with the reservation,
Right.
will you require baptism?
Okay.
You know,
Okay.
so that way you can anticipate and prepare beforehand with the number of pools you need, or dumping the pool of water out and filling up with new water,
Okay.
for example.
Okay, thank you very much. Okay, an additional question. We mentioned persons using the restroom, but I do want to ask, with common areas like the restroom, the practice of using like toilet seat covers or other things, are those things encouraged as far as keeping areas clean, keeping areas safe?
Generally speaking, it is hygienic,
Okay.
but COVID-19, SARS-CoV-19 has been found in stool as well. And so just to be safe, which is why we want, I had mentioned earlier that after someone has used a bathroom, we want it one at a time, and then if there's somewhere we can aerosolize the room right after, and that way we can keep it somewhat from any kind of aerosolic spread. That would be the only recommendation from that standpoint that I have.
Okay. What should the church do if an attending member tests positive for COVID-19 within their sanctuary?
Absolutely. So, this is a very scary situation. I know there's been a couple churches in our community who tried to open up earlier than recommended. I guess at the time it was still, and it's still very prevalent, to be honest, if you look at the current data from DHEC. But it's important that the church and the church leadership have a relationship with the public health department, public health officials, DHEC, and if anyone becomes exposed and comes back and says, hey, Pastor, I wanted to let you guys know, or one of the deacons, and lets them know, hey, I came back with COVID infection, that immediately the public health department should be notified that this is a situation, we've had someone infected who was part of our church. It takes about, there's like a 14-day rule of like how the symptoms spread and how the symptoms present themselves and how the infection basically integrates itself, and then when is it safe to return back to church. And so in order to prevent, because there's a risk if the person put a lot of other people at risk in the church, then I would recommend that everyone be notified that, hey, just keep an eye out for symptoms. There was someone, they should be notified, but we'll let the public health department guide the pastor or deacon in that community on how best to do that. But eventually, essentially using the same media platforms, text messaging, social media, or website, or whatever means you want to use, it needs to be communicated that, hey, this is a situation in our church, someone was infected with COVID-19, and please keep an eye out for any symptoms. If you do, then you should get tested, or if you're concerned, you should get tested. And then you may even want to consider withholding one of the church days so that everyone gets a chance to kind of recover before you return to church again in the 14 days, because that would complete the cycle of, that may be something to consider. But I would definitely discuss that with your public health department.
Okay. We have seen in the past couple of weeks some recent cases where, and specifically I think they've been in New York, where they're seeing that children are exhibiting some symptoms. They think it's related to COVID-19, but are not sure. And so many of our families have children who may decide to return to worship once those decisions are made. Are there any special considerations relative to children that churches in general need to think about or consider?
I think if the child is healthy and they can accompany the parents and follow all the social distancing rules, and they're capable of you know, not running around and touching everything, that age, it should be fine. There's very low risk for children, it sounds like, as far as, even though it is present. There's a lot of the population that I'm concerned about are the individuals, believe it or not, in their 30s, 40s, and 50s who have uncontrolled diabetes or obesity, underlying heart disease, prior history of stroke. These individuals are especially unique to the African American population, are the ones that we have to be very careful about as we reintegrate these churches following the COVID crisis.
Okay. Right. Okay, and we had another question that asked about persons attending general worship service wear masks, and I believe you addressed that earlier. For persons who are comfortable with that, please do so. That would be a great precaution and a best practice to use. I do also want to ask.
I would take that one more step and just
Okay,
say
that's
that
fine.
the pastor or the church leadership decide a lot of the stuff that I'm recommending, if this is absolute or relative to that particular church.
Okay.
So the ultimate decisions, it would be for the pastor or the church leadership to say, you know what, we want everyone to wear a mask. And they can provide masks or bring their own mask, whatever it is, and design it for your own church and how you feel.
Okay.
And also the employees that are working in the church or the staff, volunteers, to minimize the exposure.
Okay. Given your knowledge, and what have you heard, when do you anticipate that there might be a vaccine available for the general public?
That's a good question. So I know there's a number of promising studies going on. There are trials, I think. I believe there's some centers that are preparing for it, but they want to do it safely. But I know that a lot of people, not just here but around the world, are working actively on trying to find this vaccine, which is really what's needed to really put a stamp on this.
How reliable are the COVID-19 antibody tests, in your opinion? We've heard some differing things. Swabbing by the nose, we've heard sometimes if the individual does it, the results may not be as effective as this a trained practitioner does it. So kind of how reliable are our tests, antibody tests right now?
Yeah, I don't actually have the percentage because I know that I've also seen differing numbers. And I actually had a nasal swab test done about 6 weeks ago when we were worried that maybe there was someone in the hospital who was that we were exposed to. But I think there may be, you know, a significant amount of people who are falsely negative, and so
Okay.
may not detect. And that was a concern at the time.
Okay. Okay. Is there?
And I can get back to you on those the most recent
Okay.
numbers.
Okay. Okay. Is there a risk for reinfection from what you are hearing and seeing, since at this time there is no vaccine that is available?
So once somebody is infected, they have the virus, and so we're worried those people could spread it to other people, even though they're asymptomatic. The question is that could later on, after the 14 days, could this virus activate? And I think there have been some reports of that.
Okay, so it has come back for some people.
Yeah.
Okay. Okay.
But it depends. I have to see. I have to go back and look at the percentage. I'm not quite clear yet.
Right. So that leads me to my next question. For persons who have recovered from COVID-19, would it be beneficial for those persons to wear a mask once they are out in public? Once they come back into the general population after that 14-day stay?
Yeah, I think generally speaking, it would be healthy now for them to do that. The things that there's a lot that we don't understand about this virus. It's still
Right.
pretty new. And there are a number of concerns like, will there be different strains going around? Because we see different people getting affected differently. We're not quite clear completely. We have suspicions as to why that's happening, but there is some concern that maybe there are other strains going around. And so until we get a handle on these things, I think generally speaking, if possible, wear the cover, the mask.
Okay. We've covered a number of things here on medical guidance. Is there anything else that you feel would be beneficial to share with those, our community and church members that are listening in general, to share as far as recommendations, safety or precautions are concerned relative to congregations and groups beginning to come back together?
Yeah, I think one of the biggest things is not to feel pressured. Not to feel that the church leadership and the pastors out there should not feel that they're failing their congregation by not having these group services. If their feelings are conflicted with the safety of their flock. At the same time, a parishioner should also not feel like they're committing a sin or they're failing by not feeling the peer pressure to come into a setting. If they're comfortable viewing from home and that option is there, or praying at home, then I think safety first until we get this under control. The social distancing, unless it's essential in the sense that, like on the isolation sense, unless it's essential, like you need groceries or you need something from the pharmacy, still trying to be very cautious. We're not out of the woods yet. There's a lot of stuff on TV now where you're seeing a lot of people gathering around, and it may give you the sense that even when you go outside, you see the traffic has come back in a lot of places. It may give you the sense that we're out of the woods, but we're not out of the woods yet. So we need to be very careful.
Well, Dr. Yallapragada, we thank you so much for sharing these common and best practices and sharing your expertise. And as you and I are practicing social distancing, I'm going to thank you greatly from afar. We definitely appreciate you being here and being very candid and very open and sharing with our church and local community on medical guidance on returning to general worship. So thank you so much. And now we're going to turn the rest of this over to our Bishop Theodore Jenkins.
Thank you.
Dr. Wu, we thank you for all that you have shared with us today. It truly has been a blessing to each one of us. And on behalf of our presiding bishop, our local pastor here, and also our board of bishops, and for our many members and those that are watching, we say thank you for the knowledge. And we really appreciate you taking this time out to be with us today. And to those of you who are watching, we like to encourage you to follow the guidelines that are out today, and that is all of them. And we also realize that in many places there are somewhat different guidelines. So check with your state, your city, and with the CDC, and review those guidelines and follow them accordingly. I'd just like to reiterate two things that were said at the end. We are not in a big hurry to bring everybody back. And if you're not comfortable, when you still can watch the service through our electronic means, and we will not hold that against you. Be safe and be blessed. Again, to our doctor here and our moderator, we say thank you. Have a blessed day, and please follow the guidelines.